Hello guys and welcome back to my channel. It is your girl as always, Calista Daniels in the building. If you haven't subscribed to my channel, please do that. This month is hashtag move me to 1000 subscribers before the month of October. And today I have someone in the building this morning or afternoon or evening, anytime you'll be seeing this video. He is a health professional and is here to clarify some misconception about something. And if you want to know more about this video, please sit still and enjoy the video. So today I'll be asking him some few questions and he's going to answer my question, or rather throw more light on them. And today we'll be talking about staphylococcus. People think it's an STI. So it's here to make us know if it's actually an STI or STD or just a normal infection that you can get, not true. You know what I mean? So you are welcome to this channel, and
Thank you.
just know that we love you so much in this channel.
And I love you guys too.
It's going to tell us everything that we need to know, because me, I'm here to learn as well. I don't know much. I'm among the group of people who think that staph is a sexually transmitted disease or infection. So he's going to teach us or enlighten us more on it. So at the end of his teaching, let me use that language, I will ask some questions. Hand over to him now to continue from where I stop. So you are free now to
Okay.
teach us.
Thank you very much. Staph aureus in short, the full name is actually Staphylococcus aureus. And a lot of people believe that it is an STI, sexually transmitted disease, but of which is not. I'm extremely serious about that. Staphylococcus aureus is not a sexually transmitted disease. There are many ways through which someone can actually even recently, a friend of mine went to the lab to do a test, MCS to be specific, eye vaginal swab MCS, microscopy, culture and sensitivity. And the result came out and they said that they grew staph aureus. And she was actually worried. And the lab scientist who did the test was asking her, I think the person is related to them anyway. He was asking her, how come it means that you are living useless life? You are not doing the right things you are supposed to do. And the girl was actually worried, and she called me and she was telling me, I asked her to bring the result. She brought the result down, and I told her that the reason why you have this is not because of what you think, because Staphylococcus aureus is not sexually transmitted. And I asked him just few questions. What were the questions? The first one was, when you were young, were you having bruises all over your body frequently? And she said yes. And I said, actually, this is where it is coming from. Staph aureus is a normal flora on some person's skin.
So it means that staph is not a sexually
No,
transmitted
no,
disease.
no, no. It's not a sexually transmitted disease.
Which implies that it lives on
People's
our
skin. Yeah, you're right.
Okay, so you can continue. I just want to clear that.
Yeah,
so that
yeah.
people
That is
understand.
it. Is
But
it?
I want to understand as well too.
Okay, okay. It's a normal flora that lives on people's skin. Some persons, to be specific, some person doesn't have it. Why? They have some other bacteria that also lives on their skin.
Sorry to cut you short. Does it mean that staph is a bacteria?
Yeah, of course, staph is a
So it's
bacteria.
not a virus?
No, 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 no. It's not a virus. It's a bacteria.
So guys, now you know that it's not an STI. It's not a virus. It's a bacteria that lives on the skin that may find itself in other parts of our body.
You're right.
So you can continue.
You're right. Actually, it's a gram positive bacteria. The cocci is round. Cocci means round, right? It's a gram-positive bacteria. It's not a virus. It's not a fungi. It's a bacteria. Now, I try to explain to her that the reason why she had it is simple. It's because it's on her body. It's on her body, and one can easily, you can easily like remove it from one part of the body and introduce it close to, you understand now?
So
The vagina.
which means that if you are a person
Who is a carrier
who is a
or who
carrier,
has it on your body as a normal flora.
yeah, it means that if you don't maintain a good hygiene,
Perfect.
you can transmit it to other parts of the body.
Yeah. You are not actually transmitting.
It's already there.
Yeah,
But
it's already, you can easily move. Or you can easily like migrate. You can easily even use your own hand, use your towel to like remove it from your hand, and you see the same towel to clean your underneath region, and you introduce in there.
So you see why people think it's an STI, because if you don't maintain, as a lady, let's use as a woman now.
Okay.
So it means that if a lady does not maintain a good or proper hygiene,
Yeah.
she can transmit, let me use transmit,
Okay.
pardon me, she can transmit it from her skin to her private
Any other
region,
part of her body.
which means that if she moves it to that part of the body,
Yeah.
and she meets a man, automatically it enters into the system,
The man's body.
into the man's body, and also
No, it doesn't enter the man's body. It's not sexually transmitted.
Okay. So it enters into the
Now look at what happened. Perhaps a woman baited. After baiting, and this person is a person who has staph aureus on her skin, and after baiting, she used the same towel she used in wiping her body, and used the same towel, and after using the towel to wipe her body, she removes it from her hand or any part of her body, and use the same towel to wipe her vagina, and she can easily introduce it into her vagina. Do you understand? That is how it moves from one part. Or when you are baiting, or some people also use their hand to touch themselves. In the process of you using your hand to touch yourself, you've used your hand, this same hand you use to touch every other part of your body, you still use the same hand to touch without proper hand hygiene. You still use the same hand to touch your underneath region. You can also introduce in there.
So which means that it does not stay in, we will talk about the male part, but let's focus on women, because women, our body as women, as ladies, is open.
Yeah.
You can easily get infected. As little as it can, anything can happen. So it means that as a lady, you have to maintain proper hygiene. Correct. So it means that it doesn't stay in that region of our body, but it does that because you are having it on your skin, you now move it from that place to that side, and it's going to dwell well.
It's going to stay there and become pathogenic. The word pathogenic is that it will start causing infection in there.
So,
but when it's on your skin, it does not cause any harm. It's just a normal flora on the skin. But when it gets there, it becomes pathogenic. The word pathogenic means ability to cause disease.
So which means, so now, since when it gets to that, our reproductive,
yeah, not just only
I don't
reproductive.
mean, I'm just using that for
okay,
example now, because that is the main purpose of this video. So it means that when it gets to that part of our body as women, what is the consequences in our reproductive health? Because I know that it will not just stay there and it doesn't cause any damage to our reproductive health as a woman.
Thank you. The truth is that immediately it colonizes that place, it distorts the ecosystem of the vagina. It distorts the ecosystem of the vagina. And what happens is that other normal flora that are supposed to colonize those places, it displaces them. Do you understand?
Yeah.
And some symptoms start showing out. The woman start having itching. She start having lower abdominal pain. or pelvic pain to be specific, burning sensation, discharge from the vajayjay, and all of those things. Another thing is that if he has stayed there for too much a long time, some theories believe that, or some authors believe that it can result to infertility.
Now, I think I need to come in here. I've read some journals published online that says, not that they were specific that if it finds its way into the reproductive system of an individual, 100% it causes infertility, because there are theories that have shown that when they introduce it into the uterus of a mice,
Okay.
and it showed they did that for specific number of days, as in they had different groups of animals.
Okay.
So they did that maybe for 10 days, 5 days, and the dosage or the
Okay.
the dosage
Okay. That were inoculated
related
into
into them were different. But they noticed that those who had a higher dosage had showed, even when other things were okay, showed infertility. They could not,
Okay.
when they breed them or mate them with the male counterpart,
Okay.
they did not conceive. While some who were also exposed to it,
They could conceive.
they could conceive.
Okay.
When other physiological
Factors are abnormal. Okay.
But I think the ones from that journal, the ones that the dosage was high or the level was high to moderate,
Yeah.
showed infertility. While those who had a lower, this thing, guys, I don't know how to put it, but just understand.
Yeah.
Show actually conceived,
Okay.
even when every other factor was okay. What do you think
Okay.
about that?
Let me just throw more light on this. They are actually correct. The truth is, the amount of microorganisms, of which Staph aureus is one of them, is a bacteria, right? The amount of microorganisms that enters the body determines the pathogenicity of it.
Okay.
And now, amount of microorganisms that enters, the virulence of the microorganism, the ability of that microorganism to cause infection, also is a factor. And the host can also play a role. It also depends on the immunity of the host defense system. If the host defense system is high, it can also reduce the ability of the bacteria to cause infection. But if the host defense system is low, the ability of the bacteria to cause infection is high. What I mean directly saying is that the amount that enters, that is introduced, that the patient is inoculated with, determine the outcome.
Okay.
It happens for all microbes, not just only staph alone.
So how can a guy now, because I'm talking about, now we have gone into the reproductive side of it, the consequences when it finds itself in the reproductive system of a female.
Yeah.
What happens when a man meets a woman
Who
is down with this? Probably she might not know.
Okay.
Because sometimes people, it's only when you go for the test that is when you discover that you are having it. So let's assume that the young lady is not aware she's a carrier or she has this stuff, and she meets a man. What is the result? What is aftermath of that meeting?
Okay.
On the man's health.
Yeah. When we started earlier, we said that Staphylococcus aureus is not sexually transmitted. I'm still hitting on that. No matter the amount of time the man meets with his wife, or the spouse who is colonized with Staph aureus, she cannot transmit it to the man because it is not sexually transmitted. Now, another thing is that it's not just lady alone that could have staph. Men can have. I talked about someone who is always having boil on his body. If he's a man that is always having boil on his body, the staph can also colonize his epidermis. You know, the penile has a little opening where urine passes out. The staph can also enter from there and gradually migrate upward and go and colonize some region of it. Do you understand?
So
Even when this man also meet with his wife or with his spouse, he cannot transmit staph aureus to the wife.
So now we've talked about, now you know that it's not a sexually transmitted disease. And when it finds itself in the reproductive system of either male or female, it causes infertility.
It
Now,
can cause
it can
infertility.
cause infertility, and it has been proven that it can. So, outside the reproductive health, where else can, because I've read journals or publications that says that staph is a very dangerous bacteria
Virulence
when it
bacteria.
finds itself in the bloodstream.
Yeah.
When it finds it, because this, the reproductive aspect can be dealt with, but when it finds itself in the bloodstream,
That can be
how can,
catastrophic.
I know, I think I've read something, I watched a video or something on Facebook some time ago, a few years ago, where someone had, that was my first time of really having a little bit knowledge of staff.
Okay.
The lady came down with stuff. I don't know how she came down with it. It's a white lady,
Okay.
and it found itself in her bloodstream.
Okay.
And some part of her skin are eaten off, and so many things. That was the first time I knew that this thing. I never knew it was a bacteria. Actually,
And that is
I felt
cellulitis
I
when
felt
it
it
eats up
was
the
I
skin.
felt it was a virus or just stuff like that.
Okay.
So the white lady had staph, and it found itself in her bloodstream, and the result was deadly. As in, she's battling for her life. As at then, I don't know if she actually survived it or not. So this was kind of an awareness for people. So what do you think now when it finds, because this is what I know, I saw, I don't know
You,
whether
you,
it's
you,
true
you
or
you are
not.
very correct. You are very correct. The truth is, I said something earlier that Staph aureus or Staphylococcus aureus to be specific is very virulent. It can cause severe infection. If it's a normal flora on the skin, on the epithelial surface, like the skin, but when it mistakenly enter the bloodstream,
Okay.
how can it enter? If the skin is broken, the barrier that protects the inner melu from the outer melu is not there anymore. The bacteria can easily enter the skin. When it enters the skin, it's something else. You made mention of the white lady who the skin was clean. That is cellulitis. It eats up the skin. You think the person was burnt or whatever. Like it eats up. When it gets to the heart, it can cause infective endocarditis. My friend, the truth is when it gets to the heart, is extremely deadly. The morbidity and mortality at that rate is very high, or at that time is very high. Do you understand? Another thing about staph is that staph is could be highly resistant to drugs. Could be highly resistant to drugs. It can get to anywhere. It can cause respiratory tract infection, lungs infection. When it enters the airway, it can cause upper respiratory tract, it can cause lower respiratory tract infection when it gets into the airway. It all depends on where it enters. When it enters the GIT, it can cause gastroenteritis, it can cause infection, severe infection. Right? Do you understand?
So it means that this is not a sexually transmitted disease. Because if it's
Not, it's
sexually
not.
transmitted disease, it's not going to affect every other system of the body. It's just going to dwell on where it's supposed to be and do its work. But now it means that it can find its way in the heart, our GIT,
Our
the
airway,
skin,
respiratory tract, yeah, yeah.
every part of our body, wherever it finds itself, it causes very severe
Infection.
infection, damage, just name it. And we've talked about this. So how can someone who is a carrier, because if it's on your skin, you're a carrier, there's nothing you can do about it.
No, there's nothing.
It's
But
just there. So how can someone who is a carrier of this thing prevent it from entering other parts of the body to avoid stories that
okay, it's simple, my friend. It's simple. I made mention of when after bathing, the towel you use in wiping your body. Don't use the same towel to wipe your region. When I mean region, you understand what I'm talking about, right? Don't use the same towel to wipe your vajayjay. You should have a specific towel for your vajayjay. Do you understand? Whenever you bathe, use disinfectant on your water at least once in a day. Right after strenuous day, perhaps when you are leaving in the morning, you don't need to do that. You're bathing them, but in the evening, after strenuous day, you come back home, apply little disinfectant to your water, and with that, you can at least reduce the load on your skin. But one thing is that, my friend, for the females, always ensure that that same water you're using, that you added disinfectant to, don't use the same water to wash your vajayjay. That is a different topic entirely, because that will also distort the ecosystem of your vajayjay. Do you understand? That will even be another problem on its own. The same water that you added disinfectant to, don't use it to wash your region. Perhaps another day we will talk about this.
Thank you so much for this enlightenment.
Thank you.
So now we've talked about how to prevent it. So how can someone who has come down with this bacterial infection go about the treatment? What are the treatment methods that are available for that person?
Okay, thank you. I said earlier that Staph aureus is a bacteria,
Okay.
and is very resistant to many antibiotics. Right? First thing you need to do is that, friend, you need to see your doctor. You don't need to just go out there and get any antibiotics yourself and swallow. No, because you may be using the antibiotics that that particular staph is resistant to. You have to see your doctor. You must see your doctor. You must. After seeing your doctor, they would have to do eye vaginal swab, microscopic culture, and sensitivity to know the what is wrong with you first, and the type of antibiotics that the bacteria is sensitive to, so that in order to like treat it effectively, if you take a tablet or antibiotics that the bacteria has resistance to, you've just wasted your time. You've just wasted your time. You have to see your doctor. You have to see your doctor.
So I came across something that says that staph is a very stubborn
Very
bacterial
stubborn. Very
infection.
stubborn.
That sometimes you can even take that, go undergo the treatment, and it doesn't leave
No,
the
it's very
system.
stubborn.
So does it mean that after treatment, the person should go back to do the HVS, MCS test to know if it attacks, if the to know if the bacteria, or okay, to know if the staph
Has been
has been
cleared.
cleared from the system?
Okay, friends, that actually depends on your doctor. A normal medical practitioner knows what to do. Right? After taking the antibiotics for the number of days, not less than 10 days, some are 14 days. Staph is made like for 14 days. You swallow the antibiotics for 14 days. And after taking it for that 14 days, your doctor knows what to do. That is why you must see your doctor. Perhaps he will tell you, okay, friends, go back home, come back in 2 weeks or one more time. They will have to repeat the eye vaginal swab, microscopy, caution, and sensitivity to know if they've completely cleared the bacteria.
So guys, I hope you enjoyed this video, and in as much as I did, and I have learned so much from it.
No, let me quickly talk about it. I'm sorry.
Okay.
Proper hand hygiene. It's not only in COVID-19 they tell you use hand sanitizer, wash your hand regularly. You understand? You can. In this case, you need that, because sometimes you've touched your body, you've touched your face, and you still use the same hand to touch your without washing. Proper hand hygiene. Wash your hand always, and use hand sanitizers to reduce the load you are carrying.
So guys, it means that one, it's not an STI or STD.
No.
It can be prevented, and you can help reduce it by proper hygiene. The basic is proper hygiene.
Yeah.
When you have a good hygiene system or method, you can reduce transmitting stuff from one part of your body to the other part that
It is
is
possible to cause
yeah,
infection there.
and it doesn't stay there, but because you have transmitted it from one part of your body to the other. And I hope you guys enjoyed this video. If you did and at this point you've not subscribed to my channel, I don't know what you're waiting for. Like I promised you guys earlier on that this channel is going to be educative. It's not going to be about me. This channel is going to be filled with educative content, things to enlighten us. We will learn from it. So if you haven't subscribed to my channel, please, I don't know what you're waiting for. It's not going to cost you money or anything or energy. You just hit the subscribe button, and when you subscribe, don't forget to hit the notification button so I get notified whenever I upload a new video. So thank you very much for coming to our channel to educate us. And guys, you guys will be seeing him often in this channel because I'm actually going to dedicate one day in the week for him to enlighten us on some other health issues. And I'll also be bringing other health professionals to enlighten us, to throw more light on issues that is pertaining to our health as women. I'm very concerned about us women. So if there are any thing you want, any question, any video you want me to make on any health issue, just leave it and I'll do my best to make a video on it. And see you guys in my next video. And I love you guys.
Thank you guys. Please ensure you subscribe. Please do.